I woke up on New Year's Eve day, 2020, to an alert on my phone. And I remember it was about an emerging infection that had been identified in Wuhan, China. And I remember thinking to myself, like, oh boy, here we go again with SARS. But I could have never imagined the global nature of the pandemic that we're experiencing right now. What impacts me the most is when I call a phone number to talk to a case and I reach their spouse, and their spouse tells me that their husband or their wife is in the hospital and they're terrified that their spouse isn't going to make it. The grief and fear that you experience, it's really impactful. One of our local assisted living facilities had a large outbreak recently, and I was able to go visit and provide some technical assistance. In the COVID wing, it feels really desperate. There are never enough staff to care for all of these patients, and the patients get lonely. They're also just feeling really sick. I think people don't realize how devastating this can be. We had one facility where the infection rate was more than 50% within a 2-week period. It just transmits so quickly, and this facility had been doing everything right. There should be no stigma attached to testing positive for COVID-19. I myself tested positive. I'm the local health officer. I wear my mask. I socially distance. I don't go to large gatherings. I did everything right. And that just goes to tell you that when disease levels are this high in our community, people are going to get COVID-19. People still need to do everything they possibly can to avoid getting COVID-19. And it's not about you. It's about all the people you are going to be around in the days that you are potentially infectious. I'm relatively young and healthy, and COVID was awful. Young and healthy people may not die frequently of the illness, but it is not fun either. My plans for this year were totally different. And I think people don't necessarily think like that mean public health lady, like she's my neighbor. She's someone who, goes to church with me, whose husband loves going to the co-op and Main Street in River Falls, who hopes to send her future children to Greenwood Elementary. I think people forget that public health staff are their neighbors and their friends and their relatives, and that we aren't here to control anybody. That's not what we're trying to do. We are trying desperately with every tool we have available to protect our community. That's what public health is. We are in the corner of every school, every business, and every family in Pierce County. We are in your corner. We want you to succeed because your success is our success.